Thank you so much for joining us on this lovely Thursday night. In case you don't know who I am, my name is Marielle McLeod. I am one of the patient navigators and buddy coordinator for the Colorectal Cancer Alliance. And I am joined by my amazing co-host, and I will let her introduce herself, Ms. Kim Newcomer.
Hi, everyone. I'm Kim Newcomer. I'm a stage 4 rectal cancer survivor, and I run the Never Too Young program and the Never Too Young Advisory Board at the Alliance. And I'm so excited we're having this Facebook Live tonight. We're going to talk about some great things you should know about fertility and sexual function. So I'm going to kick it back over to Marielle to get us started.
Thanks, Kim. Well, I just want to have a full disclosure with you all. Kim and I have taken our experiences, myself as a stage 3 colon cancer survivor and Kim as a stage 4 rectal cancer survivor. And with the experiences that we have both had and shared about our journeys, we have noticed that within the patients that we serve, both in Blue Hope Nation and through the various programs that we're both over, that there is a very huge gap in the discussion of both fertility and sexual function and how it's impacted by our treatment. We will present to you guys shortly 2 of our incredible patients and survivors to discuss some of their personal journeys through these processes and how it has impacted their life, as well as how they've overcome it in one way or another. Very, very great stories, and we can't wait to get started. Also, please take into consideration we're not medical providers or advisors of any kind. We're just 2 survivors that want to have an open discussion with you all. If you do have any specific questions in regards to like the treatments or anything that we discuss, please don't hesitate to drop it in the form that we will link at the bottom for any further questions that you might have, but please have these open discussions with your doctors as well. So let's get started. So as many of you are aware, there are several treatment options for colorectal cancer that include surgery, chemotherapy, and radiation. For all of these 3 types of treatments, they severely impact our fertility. A lot of colorectal cancer patients who wish to have children biologically after treatment need to inquire about fertility preservations before beginning treatment, or if you just started treatment and have not had this discussion, make sure that you talk to your doctor about it right away. There are several options that are available for patients to preserve their fertility. For women, there are egg and embryo freezing, ovarian transposition, ovarian tissue freezing, and ovarian suppression. For men, there are things that are such as sperm cryopreservation and radiation shielding. While some cancer patients have trouble with fertility due to treatments, they've also worked with other fertility specialists. I will go ahead and provide Kim the floor to introduce our speaker.
Hi, everyone. I have the honor of introducing Miss Jennifer Ruddle. And she's going to tell us her journey and with fertility and how she actually was able to preserve her fertility before starting treatment. So I'm going to turn it over to Jennifer to talk for a few minutes and share her journey.
Hi, everybody. My name is Jennifer. Thank you, Kim, so much for introducing me. So I am a stage 4 cancer survivor. I was diagnosed in October of 2017, and I started chemotherapy in December of that same year. Now, my doctor did not talk to me about fertility preservation, but when I got ready to do radiation in June of 2018, my radiation oncologist did talk to me about fertility preservation. He told me that radiation could cause me to go into early menopause, and even though I was 41 at the time, my husband and I we don't have kids now, and we were interested in still having children. So we went and saw a fertility doctor, and like Marielle said, he gave me several different options for fertility preservation. One of those was ovary transposition, but that was going to require surgery, and I had already had 1 surgery, and I knew that I needed at least 2 more abdominal surgeries, so we didn't really want to go that route. So then he talked to me about embryo freezing. And at that time, that was the best option for me. I had to do about 2 weeks of hormone injections, 2 injections a day. I am terrified of needles. I am the hugest baby. But luckily, the needles were very small. It wasn't a difficult procedure. I was able to ice my stomach before I had to give myself the injections, which made it much, much easier on me. And then after 2 weeks, I went in for, it's a type of surgery. It was outpatient. My doctor went in and was able to retrieve eggs. I think he retrieved 22 eggs. And out of those 22, I think 17 were viable. I then took my husband's sperm and inseminated those eggs. Of those 17, I believe 10 were able to be inseminated. And then we did some extra testing to make sure that the eggs that we would have were free from cancer and other diseases that can come from, people my age that could end up having some issues down the line. So we ended up with 2 embryos that are now frozen. We actually have a girl and a boy. We know the sex of both. And once I'm done with chemotherapy, which even though I'm stage 4, my doctors know that I do not want to be chemo for life. And so that's the path that we're on. So my doctor said that when I'm done with chemotherapy, I'll have to wait about 6 months, and then we'll implant 1 egg at a time. My doctor wants to be very conservative. And in case they don't take, he wants to just do 1 at a time because we only have those 2 options.
Well, thank you for sharing, Jennifer. Now,
Yes,
if doctors have not discussed fertility with you and you've had treatments and you did not go through any preservation steps during or before your cancer treatments, there still may be family planning options for you. So we have more resources we're going to be able to drop for you later at the end of the call. So if you're worried or concerned about how your cancer treatments might affect your fertility, you have options. Don't wait, get the information right away about fertility preservation methods before you begin cancer treatments, so it can help make an informed choice.
Guys, if you want to take the opportunity to place any questions in the form that we will link, you have a section for just fertility questions that you might have that we can definitely answer to you after the conversation is over, if we have also time at the end. And the same will apply for the sexual dysfunction section that we're going to talk to you here shortly. Kim, any choice words that you want to share before we move on to the next section?
Me? Yeah, so I just want to share just a little bit about fertility preservation. And I know, like, for me, it's not an option anymore. That ship has sailed 12 years ago. But, my husband and I, we were thinking of adopting before I started treatments. And it's good to know for a lot of people who are thinking of the adoption that the best option for us usually is a foster to adopt program. And we have there's a lot of websites that have information on that. I know that a lot of cancer patients are not allowed to adopt even after their treatment is completed. So there's a website called resolve.org, what are my options? And it has great information about different options available for you. So make sure you're checking that out.
Thank you. So briefly, I want to just mention that I know that while the fertility option might not truly apply for everyone, we also want you guys to know that while, Jennifer and myself and Kim and Jacen, we are all young survivors, this is something that impacts us through the various scopes of our disease and the disease progression. The reason why we wanted to also have this discussion is because how we're diagnosed nowadays as everybody can tell, especially if you are active in Blue Hope Nation and within the colorectal cancer community, is very sad to say that we're being diagnosed at a younger and younger age. So you will get to see, unfortunately and sadly, that our faces are the new, not, knocking out the older patients, which you guys still matter to me 100,000,000%. And I know that many of the patients that I speak to on the helpline on a daily basis are in the 50 and 60-year-old demographic that still try to have an actual sex life and a very active one with their significant others. So I just want you guys to know that while you might hear young adult being thrown out throughout the conversation, does not mean that the 40 and over demographic does not count in this conversation when you guys are still just a actual living, breathing part of all of this. So I just want to make that clear. I don't want to be insensitive in any way. So the next part we're going to talk about is going to be regarding sexual function, and especially with colorectal cancer. Kim, I will go ahead and start, and then that way I'll allow you to introduce
Sure.
Jacen. Men who undergo surgery for colon cancer may develop erectile dysfunction, or ED as many know it, as a result. Surgical procedures that remove tumors from colon or the rectum oftentimes damage the surrounding nerves. Radiation, especially for rectal cancer patients, may damage the nerves in the pelvic area, which can cause lack of blood flow, blockage of blood flow to the penis, or decreased levels of testosterone in the body.
And also men who smoke or have a history of heart disease, high blood pressure, or diabetes may be at higher risk of ED after radiation therapy. These conditions may already have caused some artery damage, which can be made worse by radiation. And radiation side effects usually start slowly, and they emerge around 6 months to a year after treatment. So with that being said, I'm going to introduce Jacen Roberts. He is a Never Too Young board member, and he's just going to share his experience with his colorectal cancer with us. Jacen, do you want to say a few words?
Yeah, I'm Jacen Roberts. Thank you for having me, Kim, Marielle, Jen. It's all good to be on talking about this today. For those of you who don't know me, I'm a stage 4 rectal cancer survivor. I was diagnosed in January of 2014. Throughout that year, I had chemo, radiation, and surgery. A year later, I had surgery for my liver metastases, and as of right now, I'm almost 5 years in ED. But since this is about sexual function and sexual health, I'll get into that. Before I started my FOLFOX treatments about 6.5 years ago, my doctors never discussed fertility preservation with me. Even though I was 33 at the time and healthy, and you'd like to think, oh, young guy, maybe he wants to still have kids. They never brought it up. And I myself didn't even think about it until right before I was about to start radiation, because being rectal, everything was going to be right in my pelvic region. So the first thing I did was I'm like, oh crap. I brought it up with my radiation oncologist, and she said, well, because you've already gone through chemo, you can't do like sperm preservation. But the best they were able to offer me for during radiation was this thing called a clamshell, which is just basically like a flat, slightly rounded metal cup that they put around your testicles when you're getting radiation to hopefully prevent it from getting irradiated and killing any sperm you have in there. And I still don't know what my status is, because over the last almost six years now, none of my insurances have covered wanted to cover the cost of me getting a semen analysis done to see if I'm still fertile. Because all the insurance companies view it as like, oh, you're not dealing with ED. This is just something it's not something that's life threatening, or it's like major to your health. It's just a voluntary procedure. And it's just one of the things that so emotionally kills me, because I want to know about it if I'm still fertile. But then after I got over that came my physical issues, because for where my tumor was in the surgery I had a lower anterior resection, and it was done laparoscopically through my pelvis. I was told before the operation that I might deal with urinary issues, I might deal with erectile dysfunction issues, because they're going to be going so near the nerves and everything that cause a guy to maybe not be able to get it up as easily or not get it up at all. A few months after my first surgery, luckily I wasn't left impotent. The first time I had an orgasm after my first surgery, instead of everything coming out normally, it actually shot back up into my urethra. And when that happened, it scared the living hell out of me. And back then, I'm talking about it so openly now, but back then I was even scared to talk to my oncologist about it. But he referred me to a urologist, who then told me it was a symptom called retrograde ejaculation. And I'm like, and he's like, you don't need to worry about it. It's commonplace and it will go away on its own. And it has gone away. But when it's the first time it ever happens to you and you weren't prepared for it emotionally, you're like, what's wrong with me? Am I going to be normal again? Does this mean this means I'm infertile? Does this mean this? And as I said, away. But then the crazy part is how many guys I've spoken to in that period since who say the same things to me. No, a doctor never brought up fertility preservation with them. No, they had to bring it up themselves. Some have been left infertile. I've also spoken to other guys who have dealt with the RE, the retrograde ejaculation, and they've also said, yeah, my doctor never brought it up with me. When it happened, I was like, what the hell is going on? But then a urologist finally told me, no, it goes away. It's normal. It's just another one of those things. It's like they try to prepare you for all the side effects, but that's one side effect I found is very commonplace that nobody was told about. And right now, I think the only long-term lasting effect, as I mentioned, is that just getting a semen analysis done. Because I mean, I'm still only 39. I still would like to have kids, but I want to know if I can.
And Jacen, can I ask, how long did it take for your body to go back to normal after treatments? Is it like 6 months, a year, or feeling back to normal?
Well, I had chemo and radiation before my surgeries because my tumor was so big. So that was over the course of, I'd say, a good 9 months. After my first surgery in October of 14, I'd say it was probably a good 4 months before I was even able to get an erection again. And then later that year, I had my liver surgery, and that didn't affect sexual function at all because it was an abdominal surgery. But between that and that, I'd say it was probably between when I got diagnosed at the beginning of 2014 and when I actually felt like my physical, I always said like my physical and mental libidos were out of check. It took almost a good 4 years for my mental and physical libidos to be back in check to where I actually desired intimacy physically as much as I thought about it.
Well, thank you for sharing, Jacen. We know that.
My pleasure.
Colorectal cancer does take a lot from us, and it doesn't have to take fertility or sexual function. I feel like the first time when I started at the Alliance, I felt like I had this dirty little secret that nobody knew about. Because 12 years ago, it wasn't talked about. And then just recently, when I shared my story, I kept hearing more and more stories that were so like my own. So I think we're going to switch over now and talk about women and sexual function. But I just want to thank you again, Jacen, for being so open and honest and sharing with us.
Always.
Absolutely. And coming from a man's perspective, I applaud you for it because, a lot of, most of the faces that we see in the forefront are female patients. It's like trying to get male patients to actually talk about this just out in the open as support. And I've been there too. This has happened and kind of taken the stigma away just from having a colorectal diagnosis in general, also coming in the forefront and advocating for, your sexual performance and your fertility and things like that, especially from a male patient perspective, is very important. And I applaud you for, taking a step forward and having this open conversation and educating us. Like, I know that there are probably female caregivers that are joining us in this chat tonight that don't know how to adequately voice those questions to their spouse in a very sensitive manner. So thank you so much for talking about this openly to where they in turn can have a slightly easier and more open conversation with their significant other that is actually going through chemotherapy or radiation treatment for colorectal cancer. So thank you for that.
And Marielle, I think Jacen's also a buddy too. So
yes, he is.
If anybody.
So if you guys are a male patient or your significant other is actually going through treatment and you feel as though you would definitely benefit from having further conversations about this, please let us know. Fill out the form in the comments and we will make sure to match you up with a buddy, whether it's female or male, that has gone through something significant like this that can definitely provide you with support. And thank you for mentioning that, Kim. I know this is, our cancer diagnosis is a very lonely journey. We're accompanied by so many people, so we're not truly alone, but it is very lonely at times. But finding somebody that you can certainly get along with and connect in not just a patient level, but also something more deeper and more intimate that can definitely provide you the support that you're in need of, I think is detrimental for healing both emotionally, physically, and mentally. Leading into the sexual function topic for the female patients, I just want to give you guys a little bit of background about this. And Kim and I will kind of like giggle because it's not like a laughing matter, but it will make you understand more the reason why we want to have this conversation. Kim and I attended a conference once, and we both were in a sexual dysfunction class. Kim Kim and I had never like met each other but briefly, so I'll just leave it at that. In the middle of the conversation, nobody was interacting, so I raised my hand. And if you know me, I've never met a stranger. So I just want to ask us, I'm like, for those of us that are suffering with intimacy problems due to the side effects of vaginal dryness, vaginal stenosis, et cetera, what would you recommend for us to do that can help us improve our sexual function? No joke. This specialist looked at the audience and said, you should talk to your partner and ask them on what you can do, ask the patient, on how to improve your sexual interaction. So in my head, I'm like, that's not how it works. I'm like, I'm not asking you what I have done to ruin my sexual interaction with my significant other, but as a patient with the side effects that have happened, what can we do? So at that moment, Kim and I, we started having these open discussions on how, her rectal cancer treatment has affected and impacted her sexual relationship with her husband, and then mine as a colon cancer survivor. While our treatments are different, they're very similar in some of the courses that have happened. However, we should never be made felt like what has happened to us as part of our survival should ever be our fault. And we have, we have come to the conclusion that we losing our hair, whether you're a breast, colon, rectal, any patient that has gone through chemotherapy, that's very, I think, traumatic in a way, but it grows back. We can lose any other parts of our body, that's fine, it will grow back. But when we lose our sexual function, that is something so intimate, it's impactful. So with that said, I've done plenty of talking. I just want to let you guys know, I'm like, it angers us. We might shed a tear here and there for the rest of the conversation, but it really angers us to see how many people are impacted when this does not need to happen. Hopefully you guys can be better advocates for each other and ourselves, and Kim and I can empower and talk to you guys so much as you want, but this is not the way that it should be for anyone, young, old, purple, orange, green, indifferent. I don't think this is right. And if we're going to advocate about screening, we might as well talk about our sexual function too, because that is impactful as well. So.
Right, because sexual function affects all ages of colorectal cancer, not just young onset. I think for many of you who don't know, we usually refer to it as sexual dysfunction or sexual morbidity. It's just a long-term side effect of colorectal cancer, radiation and rectal cancer treatments, but it can be from chemotherapy and surgery for colon cancer patients as well. So any women who have had radiation, hormone therapy, chemotherapy, or other medications are at risk for vaginal stenosis, vaginal atrophy, vaginal irritation, and complete loss of sexual function. So the best thing you can do is to have open and honest conversations with your doctor, because then even if you have to go through the treatments, you have a choice. You have a say. For myself, I did not have a say. I was never told about it. 12 years ago when I had treatment, it was never brought up. And then I had radiation chemotherapy and surgery. And I actually found out from a nurse who was doing chemotherapy in the room next to me that I should have been using vaginal dilators the entire time for radiation. And for a joke, she gave me a set for Valentine's Day and said, here, go try these. So I went home and all of a sudden I was like, oh, there's not a hole there anymore. Like all of a sudden it was just gone. I had no clue. And when I had brought it up to my doctor, she had just plainly said to me like, oh, I figured you were having sex the entire time you were going through your radiation and chemotherapy. And I was like, no. But so having these open and honest conversations, or just having the option to say, yes, I'm okay with that, but not having a voice in your own treatment or what's going to happen with you is the hardest part for me. Like I would have liked to have known, even I would have still done the radiation, I still would have done the surgery, but I would have liked to know my options. And I think if we talk about this openly and honestly, I know for some of us, it's kind of not, sometimes it's too late, sometimes it's not. There's a lot of things we can do to help in that regard. But for some of us, I had even sexual reconstructive surgery that had failed. So for me, I'm actually worse off than when I started. So make sure you're talking to your doctors. Make sure you're getting all the information. See if you're going to have surgery, have 1, 2, 3 opinions. Make sure you know all of the facts, and do your research. So that's kind of my story. I'm 12 years out. I have been 8 years without sex. I mean, so and I'm 47 now. So there are other things you can, I mean, of course, there's other things you can do, and you can always see a sexual therapist, which is always great too, that helps counsel couples in sex therapy to help you kind of get back on that road to intimacy. But you should never feel like you're not a whole person, you're not good enough. You did something wrong because you lost sexual function due to treatment. So,
yeah. The sex conversation that I had was the day before I started chemotherapy, and it said, "Are you guys going to have any more children?" Mind you, I was 36. I was like, no. Like, I had no uterus. I had a hysterectomy, partial, prior to. It's like, okay, great. Just make sure that, one, you don't have sex in 48 hours, because what patient that just had chemo really wants to be intimate within 48 hours of having chemo and radiation? And two, you should wear a condom if you have sex. I'm like, okay, because that's going to help with the radiation chemo barrier in so many ways. But as a result from it, I literally, there were days and months after treatment and during treatment that I was just like, this is never going to happen. Like, my husband, I'm going to have to let him find a girlfriend, because I was like, I'm not going to be capable of, you know, meeting that, not the requirement, but fulfilling that part of, you know, my relationship with my husband. It's like, what am I going to do? And the thing is, like, with nobody talking about it, like, who do you come knocking? Like, who do you knock on the door to? And it's like, hey, by the way, I know you're a cancer patient too. I really don't know you, but you have problems having sex. Like, that's just nothing. Like, if we have problems talking about our, like, what we consider and laugh at, like, at our butt cancer, or like talking about poop and stuff like that. Like, if some people still have issues, like, it's not going to be that much easier talking about, you know, having sex and how awful and painful it has turned into when there's so many things out there. But there are various things that we can do in order to make it a little bit less uncomfortable. One of the things that Kim and I like severely researched, that I even was in shock to, I will say, is talking basically about, and this came from a conversation that I literally had on the helpline the other day. This 50-year-old lady is a year out of treatment, and she called hysterically crying because it was very painful for her to have sex with her husband. She was a rectal cancer patient and had the dilators, but they never told her that after she was done using them, she was going to pretty much suffer from vaginal dryness, which is like one of the main things that is very impactful in regarding to our sex drive and intimacy. So the conversation of lubrications comes up. And just to let you guys know, I did my research and I found out the best type of lubricants for female and males to use are need to be water-based versus gel. And the reason for that is because they're less irritating to the debilitated general tissue, whether it's vaginal or penile tissue. It's already super, super dry, and you kind of need that water base. It's basically just hydrating your vaginal canal. Just because you use a dilator does not mean that you do not need lubrication on the top. So it doesn't just go into your vaginal covering like normally it would have, but you also need to make sure that you are inserting it as far up as you can get it. If you need to put it on your vaginal dilator, make sure that you coat it very well. The same if you're having a foreplay with your husband. Excuse me for those that don't want to talk about that, but it is what it is. If your husband sticks a finger in there, just make sure that it's very lubricated. You don't want to do any damage to that vaginal tissue. And unfortunately, it will happen, but at least make sure that it's not as severe, as painful. Avoid any types of petroleum jelly or oil-based lubricants. They're not good for vaginal lubrication and will increase your risk of of developing any types of vaginal infections, such as yeast. And as women, you all know that is not the greatest thing in the world. Just saying. For you gentlemen that want to use condoms to be for any type of intimacy, with your significant other, avoid condoms that contain N9, which is called nonoxynol. And that's a type of spermicide that if you use it with female patients, it's a vaginal irritant. So it's kind of like a loose in each situation for both you and your partner. Let me see.
Do you want me to go next?
Yes.
Okay. So the other thing we talked a lot on this conversation about vaginal dilation therapy or vaginal dilators. I'm not sure if everybody knows what this is. So I have a couple props I brought in just because I don't want people to get scared away. Some people haven't seen them before. So I brought two. So here's a smaller one. And here is the next size up. I just have two on here to show. But they're medical dilators. You can get them and order them online. You get them from your doctor's office. Some cancer centers sell them. If you ask your radiation therapist, they might be able to get them for you. But it's a simple, like, I'm not a doctor. I can tell you what my doctor told me after I had my reconstructive surgery is to insert it and lay down for 20 minutes a day, especially during radiation treatment, to make sure you're using the largest dilator you can fit, and to make sure that you're sitting at least 20 minutes a day when you're doing radiation therapy and chemotherapy. But please ask your doctor. He may have different treatments for you or different options that suit you better. But we want to make sure, like Marielle said, that you're really using lubrication and making sure you're not tearing the skin, especially during radiation. Your skin's very friable and very delicate, and it rips very easily. So make sure you're really keeping the lubricant on the dilators. Another thing you can do is pelvic floor therapy. I also tried this, but I was not a candidate for it because I just, like I said, I had nothing left. But I know that we have a few of our survivors, our long-term survivors, who are doing pelvic floor therapy and that have had great results with pelvic floor therapy. So it's something you should talk to your doctor about. I think anyone with rectal or rectal cancer should really talk to their doctor about it, before, during, and after, like before you start your treatment, during and after treatment, it might be a great fit for you. And another thing I forgot to mention is also talk to your doctor about hyperbaric chamber treatments. I know that can strengthen the walls of the vagina as well. It helps blood flow get back in, and that I did 30 days of that, and it really helped me. So talk to your doctor about hyperbaric chamber therapy.
Also for pelvic floor therapy, I know that my colorectal surgeon, he specializes in pelvic floor therapy. But also if your colorectal surgeon does not, physical therapists are specialized in pelvic floor, but also if you want to reach out to your OBGYN, they will definitely give you a recommendation for somebody local that they have patients before. So I just want to let you guys know.
And don't forget, to relieve pain, you can use heat packs, a feminine cooling pad for women can be used and tucked in your underwear. So just make sure you're taking good care of yourself. Like I said, that skin is so delicate down there, especially after radiation. If you're a rectal cancer patient, make sure you're taking really great care of your skin down there.
Also, I want to let you guys know, we got a question as to when you should consider pelvic floor therapy from the beginning of treatment. And that's something that you can do throughout your entire course of treatment to post-treatment NED for like the rest of your life. It legit is like a lot of abdominal exercises that they will teach you that are specifically set for pelvic floor. And it also will vary based on the therapist that you actually go see. So what one person might tell you here might be different from over there, but they're basically pretty standard therapy that you will be able to obtain. And that's exactly where I would start. I would not wait until halfway through your treatment or until you were done to begin it. I would rather enforce those muscles and keep them active throughout the course of our radiation and chemotherapy than just wait till the end.
So I saw we had another question about who does pelvic floor therapy. It's usually a urologist. That's who I went to visit for my pelvic floor therapy, and they set you up and they do a whole bunch of tests and they can measure, and then they'll give you exercises you can use for the rest of your life to keep strengthening that muscle. So you can ask your oncologist for a referral to a urologist.
So if you guys want to walk away with any type of homework from this conversation, make sure that your first phone call tomorrow morning is to either a neurologist or your PCP oncologist or radiation oncologist, whoever it is that is managing you at the moment. make sure you do pay them a call and make sure that they give you a referral to an appropriate provider that can definitely help you with that.
Yes.
That can be definitely your greatest first step for sure.
Yeah, I've talked to survivors recently that said it changed everything for them doing pelvic floor therapy. So really take it seriously and go see a doctor.
Yeah. So some of the questions that we do get oftentimes is what type of specialist should we see if we're definitely dealing or experiencing sexual dysfunction? One of them for sure is a psychologist that specializes just in sexual rehabilitation counseling, and you can attend it as women or as a couple. Also, there are gynecologists that specialize in female sexual health, endocrinologists that focus on hormonal changes, and as well as mental health providers that can help you cope with the physical and emotional challenges of cancer. They will help you determine how to move forward, whether your partner, how to deal and discuss, have this conversation with your partner, or if you are single and are open to dating, definitely learn how to have that discussion, but look for a therapist that has the expertise in working with people with cancer and or sexual relationship issues. Yep. Awesome. I know that we have a few minutes, Kim, if we want to, and you guys have any questions, while you guys chime in with some of the questions that you might have, I just want to run through a couple of things with you all. In the questionnaire that we have in the comment section for you, I know I keep talking about it, it allows us the opportunity to answer some other detailed questions that we have. While we would love to have this as an open forum, just due to the time constraint, I know that we will be able to respond. There's a section for sexual dysfunction and fertility in the document that you guys can post any further questions that you might have and would like answered or addressed. We will definitely get that for you. So please just take a couple of minutes to get that. And we will also provide you with the resources that we have talked about briefly in the beginning and middle of our discussion. So don't think we're going to leave you high and dry. No pun intended.
Sexual health jokes.
Sexual health. I mean, and honestly, Kim and I laugh a lot about our misfortunes because, as you guys all know, if we can't laugh at ourselves through this, we will go insane. So laugh through our tears and laugh through our valleys and peaks and all of that. But honestly, there's a question, Kim, you might be able to answer. Any recommendations for those of us that have not heard about dilators until very late?
So I would talk to your OBGYN. That was my first step. And she referred me to a plastic surgeon who gave me 2 or 3 different options for reconstructive surgery. I was only able to do one. There's one where they actually take the skin from your stomach and rebuild your vaginal canal, but my skin was radiated there and they were not able to take skin. So I actually had another surgery where they take your lips and invert them and make a canal. So there are lots of different options. Just make sure you know what you're getting into. With that one, I had to have the hyperbaric chamber. I did see a question about, does that help with urinary problems? It does. It helps with your blood flow and helps reestablish blood vessels and the flow. So you can talk to your doctor about hyperbaric chamber treatments. I would actually talk to your OBGYN about pelvic floor therapy, using that dilator. Like I said, get the smallest one there is. And even if it goes in just a little bit, keep every day just a little bit more, a little bit more. You never know what you're going to get sometimes. And if you keep at it, you might be able to, or you could be like myself where there's just nothing left. But I hope that by talking about this and having open conversations with patients and survivors now, that we can help the new patients coming in and actually do more outreach to oncologists and radiation oncologists to get the word out and to stop this ahead of time. Like I said, we want to even reach older patients with colorectal cancer because they still have sexual function. There's still a life to be led after colorectal cancer. We want to make sure everyone's living their best life.
Thank you, Kim. That's a fantastic answer. Also, for those patients that have slight urinary incontinence, I found out from my doctor, especially for the female patients that have had to have a hysterectomy and no longer have like their uterus in place. I had to go to a gynonc for a consult. And one of the things that he discussed, because I was having so much pain, he said that oftentimes women will have a leaky bladder. And the reason for that is because as we're moving around, there is no uterus in place where it was to keep our bladder intact. So it's kind of like moving around. So it doesn't matter what you do. You don't necessarily need to have go through a vaginal birth or anything like that to experience a leaky bladder, but also if you're missing your uterus, that's also part of it. One question that did come across was, I think my partner is afraid to have intercourse with me. What do you advise?
Just go for it.
Yes, just try it out. I mean, have an open discussion, see as to what their fears are. If they're scared of hurting you, I would just say, what can you explain to me? Have open-ended questions to where they do most of the talking and you do more of the listening. We can sit here and say, oh, I'm fine. Like, that's not going to hurt. That's not going to hurt. But oftentimes they just want you to know that they have your best feelings at heart. My husband and I, sadly enough, had this conversation. I was just like, I want you to get a girlfriend. And I was being serious, but he thought I was joking. And I'm like, no, not really. But there's things that you have to work out. Like the patient I spoke with the other day, she was literally wanting to divorce her husband because she thought her vagina was broken. And like, your vagina is not broken. I'm like, go talk to your gynecologist, use a lot of lubrication and work through several steps. Don't settle for no. Unless you have exhausted all avenues. Have that open conversation with your partner. I'm not asking you to make them feel better for, not wanting to be intimate with you, but at least open it up for discussion, and just reassure them that everything is worth trying if you're open to it or not.
Take small steps too. I think that's important.
And you don't have to go diving in and be like, okay, and one thing that as women, personally speaking, I beat myself up a lot because I was not the same. In my mind, I wanted to be the person that I was pre-cancer. And in reality, that person no longer existed. And it's something that I'm still working on, but I beat myself up on a daily basis because I can never go back to that. Was never told, you guys have awesome questions. I was about fertility issues until about a few months ago. I've had 1 year now of chemo. Is it too late? Most likely.
Jennifer, did you say you started on chemo and you were able to preserve eggs?
I had chemo I believe I had chemo for 6 months before I did my freezing, and they were still able to go through with it. My fertility doctor did a pelvic exam and checked my uterus to make sure that everything looked good before we started. And so the chemo for the 6 months that I did didn't affect that aspect of it for me. I think the radiation would have, and obviously did because I went into early menopause after radiation, but the chemo didn't affect my fertility.
And always check with your doctor too. There might be other options. So always talk to your doctor first. But thank you for sharing, Jennifer.
Can I add on to that from the men's side?
Please.
Yes, please.
Well, I gone through chemo. I had 3 months of FOLFOX before I even thought about fertility preservation. The radiation oncologist said, if we do the clamshell, you might be okay because FOLFOX, even though it makes you feel like crap, they said when it comes to sperm function, they said it actually is less toxic than some other forms. So you probably will be good. But unfortunately, as where Jen was able to see a doctor and found she still had viable eggs, I still haven't had analysis for fertility because it won't cover it. And this is not trying to sound sexist or anything. It seems like insurance companies care more about the sexual health preservation and fertility preservation of women than they do about men, because they're like, oh, well, women, you have eggs, you can have menopause, but their thoughts are like, oh, guys can always get it up. Like, you can get it up, but you can still be infertile.
Right. And too, Jacen, I think I shared with you that new website, that resolve.org, what are my options? I think there's actually resources on that page that talks about paying for testing. So make sure this handout that Marielle and I put together, you'll all be getting it at the end. So there's some great resources in there, including some of the resources from the Alliance. So make sure that you, what do they have to drop their email?
Yeah, in the comments,
Marielle?
In the comments, there's be a link that our fabulous behind the scenes Vanna White is helping us with. Just make sure that you do put that information on there. And the question that just came in, how accurate is anti-Müllerian hormone test to test women's fertility? That definitely is a question that we're not able to fully answer 100%. So please do provide that question to your GYN, or if you're already in touch with a fertility specialist, so they can properly answer that question, as we do not want to guide you down the wrong path unintentionally. Jennifer, there's a question for you. One of our viewers, I think that's what we call them, want to know, what were your meds for chemo?
I started out on FOLFOX. I only did 2 rounds because I got very, very sick. At the time, when I was first diagnosed, I was diagnosed in the emergency room, and I spent 2 weeks in the hospital. I had emergency surgery, and I had lost almost 20 pounds. So I was down to 103 pounds. So when I started FOLFOX, it was making me really sick. I would just be super, super sick for about a week. And so I had problems gaining my weight back. So I went off the FOLFOX and just did Xeloda. And that's what I'm still doing. I've been on Xeloda for almost 3 years now.
Perfect. And I just want to thank you, Jennifer, for your answer. I just want to clear something up for those of you that have joined that haven't even yet started chemotherapy. I just want to break something down for you guys. So the typical treatment that colorectal cancer patients get, whether you go down the radiation route or you start with chemo, the first line is FOLFOX or K-BOX. You will get it in either way. The first type, FOLFOX, is basically the oxaliplatin with the 5-FU pump that you wear home for the 48 hours. So oftentimes you will hear FOLFOX be thrown around a lot. K-BOX is the exact same thing, but instead of the pump, you go home with Xeloda or capecitabine, which is basically the generic name for it, and you will take those pills for 2 weeks after you're done with your initial infusion. So I just want to clear it up for anybody that is joining that is either a caregiver or newly diagnosed that has yet to begin treatment. If you're talking about FOLFOX or anything like that, that's just the line of treatments that we go through. If you have any questions or want to learn more about the type of colorectal treatment, on our website, ccalliance.org, we have an entire section on all the different types of treatments, whether they are the normal first line defense. For stage 4, there are different treatments that we definitely receive. So make sure that you check that out if you have any questions. If not, drop a comment in the bottom. Okay. Any other questions to our famous Vanna White? Okay, I'll take this last question. Not to answer personally, but just from what I've seen. Are there any programs that help pay for fertility treatments? I know that we have a few, and I'm sure Jennifer knows of one and Kim does too, but I wanted to mention this. A while back, there's certain states that are starting to pass, and I haven't seen one in a while. I think Maryland was the last one that I saw, like a couple years back. They're moving towards, for especially pediatric and definitely young adult, covering in their legislature that to promote egg and sperm preservation prior to starting treatment. So that is a major win. However, it can't happen fast enough throughout the country. But Jennifer, do you have any type of fertility programs that you have interacted with that you could advise anyone on?
I can't remember the name of the programs, and I should know those, but I went to a fertility doctor who works with a lot of cancer patients. So he was able to help me and guide me to programs that helped financially helped my husband and I with our fertility preservation.
Jacen, if we find anything for you, we'll let you know. I want to put that on my agenda.
Thank
See
you.
if I can find
We'll
something.
ask all of our allies to be on the hunt for.
Well, I've known of places that do it, just my insurance would never cover it.
Yeah, and that's like so unfortunate. It's like we fork out all this money for insurance and we're just.
That's another conversation.
That's another conversation for us to have. So with all due respect, I have loved all of the questions and our panelists, quote unquote. Thank you so much, Jacen and Jennifer, for joining us and providing us with your perspective today. I would love to keep in touch with all of you and answer as many questions as possible as we can and be able to provide more educational Facebook Lives with you guys. Kim and I are happy to educate you on everything and anything that we're able to. We want to continue the educational series and be able to bring specialists from various aspects of colorectal cancer and how it's impacted our lives in various forums. So please take advantage of the form in the comments again, because I'm going to tell you until we hang up. And make sure that you do write any questions, and please give us any ideas on any other educational topics that you guys want to talk about. We hope that you guys all stay safe with COVID and that your treatments and scans and everything above comes out well. Please know that you can reach out to us at the Alliance for support, encouragement, to advocate for you, to be your hype man, which I'm always the hype man for everybody, and to be your support. I appreciate it.
My dog's jumping in on it too now.
I know, and mine's in the crate. He's like, Mom, get me out.
That must be like the time's up.
Yeah, but thank you so much, guys, for tuning in. We greatly appreciate it, and we will see you soon.
Thanks, everyone.